Many doctors, they have complained that patients are walking into their consulting room and crowding their consulting room. Friends, is it happening with you? Patients are walking inside consulting room one after the other. Even though they have been given appointment, or if you are not giving them any appointment, instead of waiting in the reception room, patient they encroach inside your consulting room. Is it happening with you? Many doctors, especially general practitioners, previously they used to sit outside and their examination table was inside where there were curtain or a sliding door, but they were sitting outside. And then many patients, they used to just encroach upon them like from all sides. Now because of the pandemic and COVID, they are keeping distance, but still the mentality of patients has not changed. Patient naturally, they think that if they are right in front of doctor's eyes, then doctor will see them first. Is it happening with you? Today we will share few experiences from my side and from your side. Okay. Namaste friends. I am Dr. Anil Nirale, MS MCH Plastic Surgery and PGDBA Brand Management by passion. Even I was suffering like you when I was visiting various hospitals. When I am examining one cold case, then suddenly emergency will come, or 2-3 cold patients will come together and just make a crowd over the consulting table. How to manage them? You cannot shout on the patient, no? Then what is the solution? If you have any solution, please write it in comment box or discussion box. If you are watching this video on Facebook, then do share this video with all your contacts, all your friends. And if you are watching it in YouTube channel, then do like it, and by now I am sure you have subscribed to our channel of Happy Doctor Foundation YouTube channel. You can mention your comments in comment box. So, how to avoid this crowd or overcrowding of patients? There are two types of crowd. Number one, of only patients, and second thing is patient and relatives. So, there is one patient and 10 relatives crowding your consulting room. Why we should control the crowd? That is the first thing. Many a time my students, when they are interacting with me, they say nowadays patients are lacking trust, patients are becoming violent. See, the step starts right from your waiting room. Right from your waiting room, in your reception, there should be a proper system of giving appointment. So, if you have pen and paper with you, I want you to write down the first A, and that is appointment system. No patient, whether you are a general practitioner or you are a consultant or you are a hospital owner, no patient should just walk inside your consulting room. First, they have to take appointment. Many a times general practitioners, they are giving numbers 1, 2, 3 and 10, or sometimes they give 5 counters of number 1, 5 counters of number 2, and then when the one number is called, all 5 patients enter. See, nowadays patient, they want privacy. At one time, you should see only one patient. And see, medical legally or clinically also, it is better for you, no? After all, we are human beings. There can be any error in giving injections. If your compounder is giving injections, then there may be some kind of error. then who will be responsible? You cannot say that my OPD is overcrowded. That is not the defense. So, have appointment system. That is first. Appointment system starts right when patient calls your office or your consulting chamber. Have a receptionist who will give proper appointment on particular days. Okay, that is number one. Number two is whenever patient comes with the relative. Sometimes the patient, suppose you have given appointment for 11 o'clock, patient might come at 10:30 or patient might come at 11:30. Then how to manage? As far as possible, maintain your appointment schedule. A patient of 11 o'clock comes at 11, then take him at 11 only, unless it is emergency. If you are busy with the patient before 11 o'clock, then don't take 11 o'clock patient at 10:30. You finish, take your time with your first patient and then take second patient. Now sometimes what happens, the patient of 11 o'clock comes at 11:30, by that time you have already taken your second patient, and this 11 o'clock patient, then he fights with reception. This fighting and patient getting angry is entirely different topic, and that we have covered in our course modules. Whenever you join our RP Doctor Foundation's inner circle, and when you learn PMP 10-in-1 modules, that is practice mastery program, in which you will learn all 10 modules right from patient's management, right from patient's entry into reception, and right from patients getting appointment on phone, how to manage. There is a particular management system that is called as the strategy. That strategy you will learn in that 10-in-1 practice mastery program. If you want more information about that, you can visit the link which is given in the description box, and you will get all the courses, all the training modules for doctors, and how you can complete, all the information you will get. But today let me tell you how to avoid overcrowding in your consulting chamber or in your hospital or in general practice. This is my personal suggestion, that avoid checking, avoid examining your patient in front of everyone. Many a time general practitioner, because he is busy, he examines female patient right in his reception counter itself. Try to avoid this. Okay. A patient has been given appointment at 11 o'clock, and your clinic, your office, your general practice starts from 10:30. Then first appointment following principle comes from your own. If you are given appointment at 10:30, then see to it that you are in your office, in your clinic at 10:20. 10 minutes before patient is supposed to come, you must come. I have seen many doctors, they said our patients are getting angry, and then when I interview them, when I interact them in one-to-one video calls, then I realize that the doctor itself is coming late. You are giving appointments from 10 o'clock onwards, and doctor is coming at 11 o'clock. Why doctor comes at 11 o'clock? Because he is confident that he can finish the whole lot in half an hour. Then why to waste time from 10 o'clock to 12 o'clock? Doctor thinks I will go at 11, finish the whole OPD in half an hour, and come out, go somewhere else in another hospital or for other operation. This attitude is bad. You give particular time. You have promised a patient 15 minutes, then you give 15 minutes. There is lot many things to do in that 15 minutes with your patient, because if you are in hurry, you are at disadvantage. How? If you do consultation in a hurried way, then you will not be able to prove your value to your patient. You will not be able to prove your treatment's value to your patient, and the patient will not become happy with your consultation. His fever might go with your crocin tablet or whichever paracetamol you are giving. Fever will go, but the patient will not become happy. If you create your value of yourself and the value of your treatment, and you deliver your values to your patient, then patient will be more happy. And that's what we teach in our course, 4 days WhatsApp course on how to create your values. Okay, according to the principle of value triangle success formula. The principle of value triangle success formula says, first you have to create your value, then you create your treatment's value, and when you deliver these to patients, only then patient will become happy patient and you will become happy doctor. So friends, if you want to stay in touch with Happy Doctor Foundation and get more insights on your day-to-day life as a doctor, then I sincerely request you to subscribe to our YouTube channel, to our Facebook group, and Happy Doctor Foundation's WhatsApp and Telegram group. Okay. See you with more insights in our next video. Bye.